Hello, good morning. So I'm talking about she's a pretty. Okay.
Oh, no. Hello, doctor. How are you?
Good morning. I'm doing well, and you?
I'm great. I'm great. I'm great. We'll be starting the session.
Good to
So we are
hear.
waiting for other. Okay. Thank you so much.
All right. All right. Sure. So far, eight participants.
Hi.
I can see a public here.
Boss waba. Because nyama no gu, no say nyama no gu a check safe one.
Oh, I see.
I can hear you.
Good morning, everyone, and thank you for joining us today. We'll just have to give it a few more minutes to allow others log in, and then we'll proceed from there. Thank you. Okay. Good morning, everyone, once again. And on behalf of Equity Health Insurance, I would like to warmly welcome you to today's webinar on healthy heart habits. My name is Hafsa, and I'll be moderating this session for today. So we are truly excited to have you join this morning because healthy heart is just not a medical issue. It is a lifestyle issue. And then the habits we build daily play a major role in preventing heart disease, managing blood pressure, and improving overall well-being. Today, we are privileged to have a highly experienced medical doctor, Dr. Francisca Chidi, to present to us on this webinar on healthy heart habits, which are purely based on science and then practice. So I'm happy to introduce Dr. Francisca Techiwa. Kindly proceed. Thank you.
Thank you, Hafsa, for the wonderful introduction. So as she said, my name is Dr. Francisca Techiwa Chidi, and I'm privileged today to have the opportunity to present on a very important topic, healthy heart habits. And this topic came about in honor of the month of love, which is February, and it's even going to end tomorrow. So we're just in time for that. And also we're going to center it around caring for the heart, body, and mind, and overall the community. So we'll delve into how important the heart is and the center of love being the center and how it affects our overall daily lives. All right, so this is going to be our presentation outline. We'll look at a brief introduction to heart health, the burden and statistics of cardiovascular disease, the importance of prevention, certain risk factors that put us at risk of cardiovascular disease, healthy heart habits itself, how to recognize warning signs, conclusion, and then a call to action, and then my list of references. So first of all, why is love and heart health, important in the first place, and why do they belong together? So as a basis, love affects your stress levels, and stress also affects your heart. And the heart is not just a pump. It responds to hormones, the nervous system, signals, and all these are even influenced by our daily relationships that we have with people who are around us. So feeling loved and supported lowers stress levels and also stress hormones like cortisol and adrenaline. And all this in the long run reduces the strain on your heart. So it's very important that we surround ourselves with people who love us, and eventually this goes a long way to protect our hearts. So surround yourself with people who show you love and affection, and this is also a small way you can protect your heart. So, community and faith groups strengthen adherence to healthy heart habits, keeping accountability partners. These are small ways that love helps to protect the heart in the long run. So small acts of care accumulate into long-term heart protection. Yeah. So we usually talk about health, but most people don't really know what health is. So health, mostly when people talk about health, they only talk about the physical aspect of health. But health is mainly, surrounded by three things. That is physical, mental, and social well-being. If one of this is lacking, then you're not healthy. So you could look physically all right, but mentally, if you're not okay, then you're not healthy. If your social life is weak, then you're not healthy. So we have to find a way to balance all this. So health, defined by the World Health Organization, is a state of complete physical, mental, and social well-being, and not just the mere absence of disease. So the fact that you look okay on the outside doesn't mean you are healthy. And all these domains, interconnect to have a holistic care and also to make us healthy. So we have to make sure that we have a balance: physical health, mental health, and then social well-being. That's what makes us truly healthy. So what is a habit? A habit is a repeated behavior which is triggered by a cue and reinforced by a reward. So it's something that you do daily in small acts, and eventually it becomes a part of your routine. And in order for habits to remain, there has to be some form of reward that you get from it. So the reward is usually a positive feeling that reinforces repetition. For instance, if I am going to the gym every day and I'm seeing some results when I stand in front of my mirror, I'll be encouraged to keep going. But then if I'm going and I'm not seeing anything, then I will feel like I'm wasting my time. So habits usually start small and eventually they build up. But what keeps us going is the eventual reward that we get from it. So for example, a 30-minute walk. It sounds impossible with a busy schedule for most of us, but it can be really broken down into 10 minutes, afternoon, morning, and then evening. And this eventually helps lower blood pressure and helps with circulation, amongst others. So habits can start in your small corner and then eventually you see the reward of your actions. Yes. So here is a diagram showing the functions of the heart. So this is very simplified. The heart does other complex things, but for the sake of the audience that I have, I'll try and make it very easy for everybody to understand. So the heart pumps blood, oxygenated blood to various parts of the body and to vital organs, the kidneys, the brain. So it's very important. It also supplies oxygen to other parts of the body. It delivers nutrients. It removes waste and toxins from the body, maintains a healthy pressure, and then circulates blood to other parts of the body. So the heart is very important. So at all costs, you have to protect your heart. And this is a very technical photo, but I'll try and make it very simple for my non-medics to understand so that we're all on the same page. So we can liken the heart to a machine where the heart muscles here can be likened to the engine of the machine. The blood vessels, all these complex blue and red ones, can be likened to pipes or tubes. And then the heart also has an electrical part, which can be likened to, let's say, a circuit board. And then the valves, these arrows, can be likened to a gate or a one-way gate. Yes. So at every point, if there's a problem with either the muscles, the blood vessels, the electrical part, or the valves, it's going to be a problem for us. So every part of the heart plays an important role in keeping us alive and keeping us going. So this is, the picture here is simplified for your understanding. So for instance, if there's an electrical problem, that's when you have arrhythmias coming in. If the muscles are weak, you have a pump problem, so blood can't go to vital organs. If the blood vessels are blocked, for instance, the coronary arteries, that is when you have chest pain and myocardial infarctions coming in. And if the valves are not allowing one-way flow of blood as it's supposed to, then you have valvular heart problems. So where is the heart located? Most of the time when you ask people to point to where the heart is, they point to the wrong side. But anatomically, it's located in a place called mediastinum. And that's the central part of the thoracic cavity. So it's in between the two lungs, if you can see that. The size of the heart is mostly the size of a clenched fist. So if you clench your fist, that's about how big your heart is. And it has 4 main chambers, 2 at the top and 2 below. The 2 top ones are called atrium, and then the lower ones are called ventricles. Today, I'm taking us to medical school, but yes, just so we get something little about the heart. So we have 2 atria and then 2 ventricles, and they all play a role. So oxygen, blood comes from the right side. It is deoxygenated. It goes to the lungs, and then it is oxygenated and eventually leaves the left side of the body, the left side of the heart, to vital organs. So that's basically what, the heart does. And this is a very simplified photo as well. So blood from the body, deoxygenated, goes to the right side of the heart. The lungs help purify the heart, in quotes, the blood, and then it goes to the left, it leaves from the left heart to various parts of the body. So this is pulmonary, which is lung, versus systemic circulation, how blood gets oxygen to be delivered to tissues. Yes. So this is everything I've been trying to explain. The heart beats for about 60 to 100 times per minute for a healthy adult. Yes. So that is about 100,000 beats per day. And then overall in a year, that's 35 million beats per year. And the heart works continuously from birth to death without rest. So it means that it's doing a lot of work. So we have to do whatever it takes to also, support its work because it beats non-stop. The day it stops beating, it means we are dead. So the heart really does work over time. So we have to protect it at all costs. And that is what this presentation would show us. So why are we even having this presentation in the first place? Why healthy heart habits are important? So if your heart is not healthy, you're not going to be able to come to work and you're going to have a lot of productivity from sick days. Assuming all our colleagues who are at work right now are not here because they have some form of heart disease. Work can't go on and the company can't survive. So it's very important. Also, if you're not healthy, generally it puts a lot of stress on yourself and your family. Usually when you visit hospitals, you realize how much a lot of people are sacrificing to be around their loved ones when they're on admission, and it's not a pleasant sight. So as much as possible, you don't want to burden your family and even yourself. So it's very important to maintain a healthy heart habit. And also the cost of rehabilitation and treatment. It is easier to prevent disease than to treat it. Treatment and cost of heart conditions are quite costly, even from the labs, the medications, and even maintaining it. So as much as possible, we always have to try to, prevent it from getting to the point where we would require admission and medication. And then an important point to note is that cost is not always functional. Usually when people hear the cost of unhealthy habits, they think about medical bills, gym fees, medication expensive, but the real cost is the energy that is lost, the years and the times that you're supposed to be living your best life, but you can't because you are ill. And then your relationships that would not really sustain in your absence because people need you around. Your family depends on you. Society depends on you. So let's consider not only the monetary aspect, but the cost of disability and also early retirement from when you're actually supposed to retire. So it's very important to keep a healthy heart habit. So this is a very simplified photo that is showing us a bit of epidemiology and statistics of cardiovascular disease from the World Heart Federation. So cardiovascular disease is actually the #1 world killer disease. Yes, I feel like people are mostly afraid of HIV more than they fear heart failure or cardiovascular disease, but it's supposed to be the reverse. Because if you look over here where my cursor is, cardiovascular diseases account for 18.6 million of diseases. Cancer is doing about 10 million, respiratory diseases 3.7, and HIV that is feared the most is just contributing to 1 million. So truly, the true enemy here is heart disease. So if there's anything you should be running away
So that's the point.
Your more verification.
Hello, Tim. Please, we can't hear you.
Okay, team, just kindly hold on. We'll be joining back shortly.
Hello. We're so sorry about the technical glitch. We had some issues with our internet, but we're back on and we really appreciate your time and we are so grateful that you stayed on for us. So I'll continue from where I left off, please. Thank you. Please, can you see my screen? Can anyone help me? You can kindly let me know. Anyone at all? Can you see my screen, please?
Yes, please, I can see.
All right, thank you so much, Madam Rebecca. All right, so we're continuing,
Welcome.
please. Apologies once again. So I was talking about the statistics with cardiovascular disease. Sorry about that. Yes. Yes. So as I was saying, cardiovascular diseases accounts for about 31 to 33% of deaths globally, sorry. And then non-communicable diseases in Ghana, which are diseases which comprise of heart disease, stroke, diabetes, cancers, and respiratory diseases, accounts for about 45% of deaths in Ghana. And tell us yes, the whole point of this slide is to help us know that
Hello, everyone. Yes, once again, good morning. And then we apologize for these technical issues. We'll be shortly back up. And then in the meantime, if you have any questions on where you've gotten so far, you could kindly ask them whilst the team is working on the little glitch. Thank you. Yes, once again, morning.
Hi, everyone again. Please, for the meantime, if you have any questions, kindly drop them in the chat box and then we'll respond to them one after the other. If you also need to speak, kindly raise your hand and then we'll call you upon to ask your question. Thank you. Sorry about that. We're so sorry. We're having some internet problems today. But I was talking about the common risk factors for developing heart diseases and how they can be grouped into two, modifiable and non-modifiable risk factors. So usually the non-modifiable risk factors are things that we can't change. We can't do anything about it. And I was talking about genetics and family history. And I was also emphasizing on the fact that, I mean, these days anything is possible, but generally speaking, you can't really change your genetic makeup. Yes, so if a first degree relative has had some form of heart condition in the past, it's not cast in stone that you're going to get it, but it just puts you at a higher risk than someone who hasn't had a relative or someone have it in the past. And then age is also a risk factor for developing heart diseases. So the longer you live, the longer your blood vessels are exposed to stress and then damages. It can be likened to a machine where continuous use leads to a wear and tear. So that's, unfortunately, we can't do anything about it. Day in, day out, we are growing. And then, of course, at some point, our body gives up on us. And then sex. So these days, there's a lot of things with gender, pronouns, and all that, but science usually still considers male and female as the only genders that, I mean, a lot of these things apply to. So men tend to develop cardiovascular diseases earlier in life than females. And the advantage that we females have over men in the early ages of life is that we tend to have estrogen, which is cardioprotective in a way. So it protects cholesterol levels, blood vessel integrity, and also generally the overall cardiovascular health. However, as we grow and we hit menopause and estrogen levels drop, we tend to also have a higher risk of developing cardiovascular diseases. So men tend to show cardiovascular diseases earlier in life than females. And the only advantage that we have over them earlier in life is estrogen protecting us. But when that drops, as we reach menopause, then we also are at risk of getting it. And then race and ethnicity. So generally, Black people are at risk of hypertensive disorders and then cardiovascular diseases. South Asians and also Black Americans in general, more than the white people were. So already we are at risk of getting cardiovascular diseases. So the key thing I want us to get from these non-modifiable risk factors is that we can't change them, but we can liken it to loading a gun. Until you pull a trigger, it's not going to cause harm. So the things that we can do to manage this is what we term as the modifiable risk factors. And thankfully, those ones are a lot more than the non-modifiable risk factors. So we can moderate our salt intake. A lot of people these days taking a lot of salt and sodium in our diets. It's almost as if we can't run away from that, but the recommended salt intake per day is 1 teaspoon. And this should apply to every meal you take. So in all, at the end of the day, what's the amount of salt you take should amount to only 1 teaspoon of salt. But if we check our diets, we realize that we are way over the target.
And that is about 5 to 6 grams of salt a day, according to the American Heart Association. And they even sometimes say 3/4 of a teaspoon, but generally speaking, 1 teaspoon of salt is all you need a day to keep a healthy heart habit. And then diet quality. Thankfully for us, we live in a society where we've been blessed with so much food that is rich in nutrients, but you see that these days we're leaning towards what the white man takes a lot. But foods like kontomire, which is called taro leaves, is very high in vitamins and fiber. Garden eggs is low in calories and high in antioxidants. Beans is an excellent plant-based protein and lowers bad cholesterol levels. Oats and millets are also rich in fiber. So we realize that we actually have a lot of food that is good for our health in Ghana, but we're rather ditching those ones and leaning towards the fancy ones these days. But we should go back to our roots indirectly. Alcohol intake is a very sensitive topic that there's been a lot of debate about. Is alcohol good? Is alcohol bad? Some people even challenge that, oh, red wine is good for me and all that. But we're going to talk about all that in a jiffy. So the National Center for Health Promotion and Disease Prevention in the United States says that ideally you're not supposed to drink, but if you choose to drink, drink in moderation. And what that means is that for females, you're not supposed to take more than 1 drink per day. So in a week, you're not supposed to take more than 7 drinks in a day. And then men, you're not supposed to take more than 2 drinks in a day. So in a week, your limit is 14. And this doesn't mean that because you have this leeway, you can just sit one day and then binge drink and then it makes up for the whole week. No, that also has its side effects. So it doesn't mean Friday night you just go and sit down and say, okay, this week I'm not taking any alcohol, so I'm going to claim all my 14 drinks that I'm allowed to take. No, that's not going to be possible. So funerals and weddings are not excuses for us to binge drink, yes, even though we have a limit. Yeah, so as much as possible, if you don't take alcohol, maintain it. But if you are into taking alcohol, then drink in moderation. And females are allowed 1 drink per day, and males 2 drinks per day. Pregnant women and children, of course, as we know, are not supposed to take in alcohol at all. And so the reason why, someone will be wondering why women have a lower threshold and then men are allowed to take 2 per day, and why only women is just once a day. So women reach body alcohol concentrations faster than men in general. And women, if you compare to men, have a lower body weight, less body water for the dilution of the alcohol we take, and then a higher body fat. So all this put together puts us at a higher risk of intoxication from alcohol than the men. That's why they have that safety net of 2 instead of 1 like us. Smoking goes without saying, it destroys the arteries and blood vessels, which puts us at risk of heart disease, air pollution, and also medication adherence. So I've come to realize that a lot of people actually have been told at some point in their lives that they have hypertension, but I think counseling these days is not so great, or maybe they choose not to hear because they are in denial. So even though they know they are hypertensive, you meet them and then they'll tell you, oh, the doctor said I should just take the drug for 30 days, 1 month, now Mejai. But that is not what it is. Before you stop your medication, you have to go back to the person who prescribed it for you to see how you are faring on it. And most of the time, we don't abruptly stop antihypertensives. We review them and then we take it out from there. So if you've been told that you are hypertensive, please don't be in denial. I mean, if you want a second opinion, you can always seek that, but try as much as possible to take medications that have been prescribed for you, and this goes a long way to help. Overweight and obesity, this goes without saying, and we usually get this through BMI, which is the body mass index. A normal healthy BMI is usually 18.5 to 24.9 BMI. Overweight is above 25 to 29.9, and then obesity is a BMI of more than 30. So as much as possible, we don't want to get to the obese level. And things that put us at risk, low physical activity and fitness. You tend that you don't move a lot. You're always sitting in one chair at work, and then you drive to work, come back to work, you're driving. So you barely walk these days. Sleep disturbances, it really goes without saying. At least you're supposed to have 7 to 9 hours of sleep per night, yes, if everything permits. And then it's not only about the duration, but the quality of sleep and then the regularity. All these are also equally important. Psychosocial stresses, work is stressing you, marital issues, relationship problems. The world itself has been programmed to stress us one way or the other, but we have to make the conscious effort to, make time for ourselves. High salt consumption, I've spoken about that already. Instant noodles, salted fish, all these are very high. And if you check it, it's more than the 1 teaspoon limit that we are allowed in a day. Urban sedentary lifestyle, like this picture is showing here, fries and burgers and Coke, this is the new-ish thing. So if you're not doing it, you are seen as uncool, but we are actually swaying away from our traditional food. And then poor screening culture. I mean, luckily for us, Equity does a lot of screenings at workplaces. So we, as much as possible, have to engage in them. And this will help us, know our baselines. And then we take it out from there if there's a need to see a physician. And then this question is for us to think about how many of us know our blood pressure. I know my blood pressure, but I don't know about you. So you can check it over the weekend or any other day that you can get. But as much as possible, just know your baselines and then take it out from there. So more statistics and epidemiology. I'm sorry, I tend to like numbers a lot, but key risk factors in Ghana for cardiovascular diseases, out of everything I've spoken about so far, hypertension is the leading risk factor. It accounts for 26.1%, and this goes without saying. Obesity is also somewhere at the top, 15.1%, and then diabetes. So these three are the main things that are causing cardiovascular problems in Ghana. Again, hypertension is the leading cause. So please check your blood pressures when you can. So what are some of the healthy heart habits that we can incorporate into daily life? Practical and evidence-based. So eat more fruits and vegetables. I listed a lot of local foods that are rich in vitamins and fiber that is good for us. Maintain a healthy weight and metabolic control as much as possible. Keep your BMI between 18.5 and 24.9. By checking regularly your blood pressures, your glucose, and your cholesterol levels. Manage stress and sleep. So mindful practices, faith-based supports, and then at least 7 to 9 hours of sleep will help the heart. Regular exercises. So the recommended exercise duration per week is 150 minutes of moderate exercise, and then 75 minutes of vigorous exercises. So you can just break it down along, the 7 days of the week. If you have 150 minutes that you can just exercise, you can have your own routine and plan. And then stopping tobacco use, this goes without saying. It drastically reduces your risk of heart diseases if you stop. And then routine screening, as I was saying, Equity does that a lot. So you can just, participate. You can check your sugar levels, your cholesterol levels, and early detection prevents progression. So tips for busy professionals, how to integrate healthy heart health into a demanding schedule. So for instance, something as simple as this, instead of taking the elevator, you could use the stairs and you'll be meeting your 150 minutes per week target. So you could start with something little. Instead of using the elevator, you could walk instead and use the stairs. And then SMART goals. So I want to talk more about SMART goals and what they are. So SMART goals is an acronym which stands for, the S is for specific, the M is measurable, the A is achievable, the R is relevant, and then T is time bound. So every goal at all, you can apply this to any aspect of your life. So every goal you set has to be SMART. It has to be specific, measurable, achievable, relevant, and then time bound. So for instance, at the beginning of every year, we all set goals, even without realizing that we're using the SMART goal approach. So most people say, okay, by July, I'm supposed to buy a Tesla or a Range Rover. That's a SMART goal that you set for yourself. But how about we apply that to our health? So some of the SMART goals that we can start is, I will replace snacks with fruits or nuts at least 5 days a week, starting Monday. This is very specific. It's measurable, it's achievable, it is relevant, and then also it's time-bound. More examples are that I will walk briskly for the next 30 minutes for 5 days a week for over 3 months. Or I will practice 10 minutes of deep breathing and meditation every morning for the next 30 days. Or I'll be in bed by 10:30 p.m. every night so I can get 7 to 8 hours of sleep every day or starting today. So these are things that we can do in our own small corner, because people will say they are very busy to go to the gym or something, and they'll just grab a quick dinner on their way. But I mean, you can incorporate these things. It's small, but as we said, habits start small until you start seeing results. So these are things that we can incorporate into our routine, and it will go a long way to help us. So I want to talk about some danger signs that we have to be aware of. Signs of heart failure and congestive heart failure. So typically chest pain, you usually feel this when you do something or an exertion, shortness of breath, dizziness and lightheadedness. Not every dizziness is anemia. Sometimes it's from heart failure. Swelling of legs, feet, and hands. And a lot of pregnant women, when they have this going on, the people around them in society will just tell them that, oh, it's either they are going to have a male child or their husbands are feeding them well. That's why their feet are swollen. Sometimes it's not the case. And sometimes when your feet are swollen, it could actually be hypertension that's knocking at your door. Sudden weight gain is not supposed to be so. And then sudden weakness and fatigue, because we know what the heart does. So if you're having any of these symptoms, please visit the nearest health facility. And then one acronym I want us to also remember is to know the signs of a stroke. So it's called FAST. It's your face drooping. You could see that sometimes there's weakness on one side of the face. So it feels as if that side of the face is weak and it's not really moving when you talk. Your arms, are you able to raise both arms? So that stands for the A. Is your speech slurred or jumbled? Mostly if you've seen someone with a stroke, you realize that when they speak, you can't really hear them clearly. And then also time. So if you have an emergency, please call the nearest health center that you know. So this, the mnemonics that we can use to quickly identify a stroke. Your face drooping. Can you raise both arms or there's weakness? Is your speech slurred or it's clear? And then also act fast, so time. So we'll be ending shortly, but some heart myths versus reality. So I want to debunk certain common misconceptions about cardiovascular disease. And I'm sure from this presentation, we've gathered it. So as we know, I'm too young to worry is not true. Plaques start building up right from childhood. So gone are the days that people used to think cardiovascular disease are only for older people. But these days, we've seen time and time again that 20-year-olds, 30-year-olds are coming in with hypertension and heart failure and all that. And also, one thing people commonly say is that they will know if they had high BP, but that is not true. Hypertension, that's why they call it a silent killer. It won't announce to you. Next thing you know, you have a stroke. So usually it comes with 0 symptoms. You wouldn't know until it's too late. Heart disease is a man's problem. We have come to know that the only difference that men tend to manifest it earlier than women because of our estrogen, but it's the leading cause of death for women too. I'm too skinny or I'm too slim to worry. That is not true. It's not only fat people that get cardiovascular disease. You can still be skinny and have a heart disease. The only power that you have is if you know and you check your baselines regularly. So take home message, just love your heart one step at a time. Choose one new healthy habit this day. I've listed a few things that we can use our SMART goals to achieve. You could walk, you could reduce salt, quit cigarettes. 1 cigarette per day. Schedule a screening with us today. Use faith and community for accountability and support. These days, there are a lot of run clubs in Ghana that are coming up. They meet on Saturday. So you could join a run club. You never know. You could just meet more people that will keep you accountable. Early detection and small changes save lives. And then finally, if you have any of the symptoms that I listed, please seek care promptly and don't delay at home. So I would like to end with this quote that says that every action you take is a vote for the kind of person you want to become. And this is from James Clear. So little habits, mighty drops of water makes a little drops of water makes a mighty ocean. So you could start today, set a SMART goal today, and then stick by it. You never know what it will do for your health. So these are my references. Thank you so much for staying with us despite our internet challenges, and then the floor will be open for questions. So thank you so much.
Okay, thank you very much, Dr. Francisca Chidi, for such an informative and practical session. I'm sure we have gained some knowledge on healthy heart habits that we can use in our day-to-day lives. kindly drop your questions in the chat box, or you can raise your hand and we can have a discussion on what was just presented on. Thank you. Okay, so we have one question from Felix. Number one is, can palpitation lead to any, okay, I'm sure he meant lead. Can palpitation lead to any heart-related conditions?
Okay. I think we can read all of Felix's questions so that it's clear.
All right, sure. So the second question is, can some medication affect the way your heart functions without you knowing? And then the third question is, what are some healthy foods that can help improve the functioning of the heart?
Okay. Thank you so much, Felix, for the thoughtful and brilliant questions. So can palpitations lead to any heart-related condition? So palpitations, I mean, for those who don't know, is just an unusual perceiving of the heart beating. Usually, when the heart is beating, you're not supposed to feel that the heart is beating. But when you have palpitations, you become unusually aware of the fact that your heart is beating, and this is not good. So his question about can palpitations lead to heart-related conditions? So it can, and then also heart-related conditions can lead to palpitations. So for instance, the reason why I can say that palpitations can lead to heart conditions is that, let's say for instance, anemia or chronic anemia. Anemia leads to what we call high output heart failure. And one symptom of anemia is usually palpitations, yes. And if you have palpitations which come from anemia, that can lead to heart failure. And heart failure in itself, a symptom of it is also palpitations. So yes, it goes both ways. Palpitations from, let's say, anemia can lead to heart-related conditions, and heart-related conditions themselves usually manifest with palpitations. So yes, that's a good one. Can medications affect the way your heart functions without you knowing? Yes. In a good way and in a bad way. So some medications affect the heart. For instance, steroids. Steroids, which these days, not these days, can be found in the creams that women use, topical steroids, for bleaching and all that. They lead to hypertension. And we've come to understand today that hypertension affects the way our hearts function. So a quick drug that I can think of top of my head would have to be steroids, which is very common in parts of the world. But good drugs, which are antihypertensive, calcium channel blockers, beta blockers, also affect heart functions, but this time in a positive way. What are some healthy foods that we can take to help improve the function of the heart? So we have a lot. I listed a lot of them. Luckily for us, we are blessed. We have contomere, which are taro leaves. They are high in vitamin and fibers. Garden eggs, they are low in calories and high in antioxidants. Beans is an excellent plant-based protein source. And then oats and millet. So you can incorporate all these and remove the instant noodles and burgers from it, and then you see your heart thrive better. So thank you very much, Felix.
Okay, so Felix, I'm sure your question is answered now. If you still need some clarification, kindly drop it in the chat box. We move on to the next question from Rebecca, which says, please, what is the cause of severe headaches?
So there are 1,001 causes of severe headaches, Rebecca. But what I can say is that if you have severe headaches, the best thing you can do for yourself is to speak to a physician who would help you narrow down the cause of the severe headaches. So a lot of things can cause severe headaches. Headaches are non-specific symptoms. And what I mean by that is that you could have even malaria giving you severe headaches, migraine giving you severe headaches, anemia giving you severe headaches. high blood pressure giving you severe headaches. So a lot of things can cause severe headaches. So if you happen to have severe headaches, please don't self-medicate. Or if you try your paracetamol and it's not working, it could just be your blood pressure that is in the 180s or the 200. So quickly run to the nearest health facility for assistance so that a qualified doctor can diagnose your headaches. Thank you so much for your question. What causes blood clots in the head or brain, and how can it be cleared? So that's a good one. So usually if you have a blood clot in your brain, that is what we call an ischemic stroke. So there are two types of stroke. We have hemorrhagic stroke and an ischemic stroke. So hemorrhagic stroke is when you are bleeding in your head. I mean, in the street, you hear people say, oh, internal bleeding, or he was bleeding in his head. So usually that's a hemorrhagic stroke. So what your question is asking about is an ischemic stroke, when there's a blockage or blood clot in the head. And that comes about when you're exposed long term to these risk factors that we've been talking about. The blood vessels in the brain are very tiny, such that over time plaques build up. So as it's building up, there's damage in the lining of the blood vessels. Eventually, it forms a clot, and then blood can't flow. And that is when you have all these strokes and the fast symptoms that I spoke about. And if it's in the heart, that's when you have a heart attack or an ischemic myocardial infarction, as we'll call it technically. How can the blood clots be cleared? So one thing for sure is that it can't be cleared at home. You would have to visit a health facility, but it can be cleared either with medication or surgical clearance, yes. So in advanced places, and even in Ghana, we actually have neurosurgeons going in to take out blood clots from people's brains. And then also medications which are called anticoagulants and also thrombolytics, thrombolytics such as alteplase and things can help clear clots from the head. But again, it's all dependent on when you arrive at the hospital. So if you have this question, or if you know anyone who has blood clots in their head, they should visit the hospital. Thank you for your question.
Okay, so we have another question from someone, a Zoom user. What causes heart enlargement?
Okay, so thank you for your question. Heart enlargement, the medical term is what we call cardiomegaly. So it means your heart has become big, cardiomegaly. There are lots of causes, and all these things that we've spoken about so far can cause heart enlargement. Hypertension, causing, the pressure to increase, so the heart is going to be pumping higher than it's supposed to, and then it's going to cause the muscles to become hypertrophied. So it causes some form of heart enlargement. So all the risk factors that we've spoken about with time will lead to heart enlargement. So yeah, thank you.
Okay, so we have another question from Ajiman, which says, can severe anxiety lead to heart?
Yes, so thank you very much, Ajiman, for the question. Anxiety in itself can lead to a raise in high blood pressures, which will eventually lead to heart diseases. And sometimes anxieties are not just in isolations. There are certain conditions that can cause it. And ideally, you're not supposed to have anxiety. So if you have anxiety, it could either be a psychological problem, or sometimes it could be part of certain conditions. So for instance, thyroid diseases or goiter, in certain instances can lead to anxiety, which could raise blood pressure. So yes, you are very right. Anxiety in itself, whether severe or mild, eventually could raise blood pressures.
Okay, I think we have a follow-up question on the heart enlargement, which says, is there a cure for heart enlargement?
So there isn't any cure for heart enlargement in itself. However, the things that lead to the heart enlargement can be managed or can be treated. So for instance, if you're having your heart enlarged or you're having cardiomegaly from, let's say, hypertensive disorders, there are medications that we can use to manage hypertension so that you don't, your heart eventually feels better. But heart enlargement in itself, we can't manage it, but what is causing the enlargement is what we manage. So yeah. So there's nothing like we're going to shrink your heart. No, it is what causes it that we would manage.
Okay. Do we have any further questions? Please, if you have any further questions, kindly drop them in the chat box and we'll answer them quickly. Okay, we have a question from Ajiman that says, can increased dosage of high blood pressure medication cause drowsiness?
Yes, so Ajiman, thank you very much for the brilliant question. Just like all medications, there are side effects and complications. So that is why it's very important not to self-medicate, number one, or increase the doses of a drug on your own. I've seen a lot of people come to the clinic and then they're like, they took one of this and they don't feel like it's enough, so they go on to increase the dose on themselves. And sometimes, for all you know, you've reached the maximum allowable target for that particular drug. So for instance, so those who are on antihypertensives, I'm sure you know of amlodipine. It's a very common drug that's given to Black people who have hypertension. And one common side effect of that drug is already making you dizzy or drowsy. So imagine if you don't know and you go and increase it from 10 to, let's say, 20, which you are not supposed to do, that will cause dizziness. So yes, antihypertensives in itself cause some dizziness. And the dizziness usually comes from the fact that if you've overdosed, you're going to lower your blood pressure. And when your blood pressure is lowered, it can make you have this dizziness from the hypertension. So yeah, that's a good one. Thank you. So please don't adjust antihypertensive doses on your own. Seek your physician who prescribed it to guide you.
Okay, I'm sure that Ajiman's question has been answered correctly. We have one from Adubi, which says, we've more or less built an addiction to junk food. Does moderation help?
All right, so thank you, Adubi, for being vulnerable and sharing this with us, and for your very brilliant questions, because I know a lot of people can relate to this. It's so easy to just go to a fast food joint and you buy instead of going to cook at home, but you always have to start from somewhere. That's why I started this presentation by defining what habits are. It's not easy to break a pattern, but you always have to start from somewhere. And again, like I said, community and having an accountability partner will really go a long way to keeping you in check. So, I mean, it's not going to be easy to just say you're stopping all the burger and the pizza today, you are changed. No, then that'll be you deceiving yourself. But you can start from somewhere. And I'll list certain examples like our SMART goals that we spoke about. You can say today, I'm going to start, maybe let's say from tomorrow, I'm going to replace my burger with, food that I make at home. And I'm going to try this for the next 3 weeks, and then I'll see how this works for me. It's not like I'm going to stop it along the line, but little minor achievable goals, eventually I'm going to see results with it. So yeah, it's going to be difficult for you to say you're going to stop on your own, but have someone you can talk to who will keep you accountable. Start from somewhere, very little goals, achievable goals. And then maybe if you take 2 burgers in a day, you can start by taking 1, let's say over the weekend. And then next week, you're taking only 1 a week, and then once a month. Then you realize that, no, it's not even attractive to you anymore. So start from somewhere and get an accountability partner, and you'll be grateful that you started.
Okay, so we have another question that says, is there a home remedy for hypertension, or what can we do to avoid? I think there are 2 questions, so let's answer one first.
Okay, so I know the angle you are going for with, is there a home remedy for hypertension? And I don't practice herbal medicine, so I can't speak for that. But what I know is that, I would really encourage you to visit a health center or a health facility if you know you have hypertension. However, if we are talking about home remedies that we can do to even prevent this from happening, that's when I spoke about these salt intake, alcohol intake, fatty foods, spicy foods, these instant noodles. These are minor ways that we can, tackle these issues from home. But if we're talking about a home remedy to treat hypertension on its own, that may be difficult from where I stand. But there are certainly a lot of things you can do from home to even prevent you from having hypertension in the first place. So yes, what can you do to avoid it? Exercising, first of all, knowing what your blood pressures are, joining screening programs, which Equity does a lot, cutting down on sugary foods, fatty foods. I mean, all this. It sometimes sounds hard to do, but when you start, you actually realize that these foods that are healthy for us are way cheaper than the junk food that we've been buying. I listed a lot of them. Contemporary beans, garden eggs, all these are readily available, and then they're also very affordable. So thank you for your question.
Okay, so we should be wrapping up by now. So if you have any further questions, kindly don't hesitate to drop it for us to answer it before we end the webinar, please. Okay, so we have a question that says, can high blood pressure gotten hereditarily can be cured?
Okay, thank you, Ajaman, for your question. So if sometimes it's very hard, like I said early on, it's very hard to pin hypertension on one particular cause. You can't stick your neck out and say, okay, my father had hypertension, that is why I'm having hypertension. No, there's a reason why it's called a risk factor and not a sure factor. It just puts you at risk, doesn't mean it is what gave you the hypertension. A lot of these risk factors come into play together. It's holistic. They all play a part, yes. So back to your question, can it be cured? Hypertension is managed. Yeah, it can be cured per se. Usually it's managed. And when it's managed, you can live your best life. People are 90-year-olds and they're still taking their antihypertensive. So yeah, hypertension is managed day in, day out. And in this day of modern science, you really don't have to stay at home with hypertension at all. It's very easy to manage and you'll be living your best life with it. So yeah, it goes back to the point. You can't really point that this is what gave you the hypertension, but you can certainly do something about it to manage it. So thank you for your question.
Okay, so a question from Saya. There is currently a trend of taking in more proteins to aid weight loss. Is that a good practice?
I am not familiar with this, but I mean, I know that if you go to the gym, for instance, there are protein shakes and other things that are recommended, and not really for weight loss, but it helps build muscle bulk. Yes. So proteins in itself don't help. Maybe you can help me with the kinds of proteins, but proteins in itself don't help with weight loss. They help build muscle bulk. And I mentioned rich sources of plant proteins that we have, beans, legumes. All these are rich in proteins, but I'm not too sure about more proteins helping with weight loss, but thank you.
Okay, I think, Saya, if you have examples of the proteins you are talking about, you can leave it in the chat box so that you can get a clear explanation to that. We also have a question from Esther, which says, what does aphrodisiac foods and drugs do to the heart?
Okay, so for those who won't know, what aphrodisiac foods are, examples are chocolates, avocados, pears and all that. They can be good for the heart. For instance, black chocolate or dark chocolate, avocados in our setting, which is pear. So they help, with good mood. And like I said, aphrodisiac foods, if we are munching on your chocolate at a healthy limit, it makes you happy. It's like your guilty pleasure. And good mood will influence your heart. So everything in moderation. If you have an aphrodisiac food that you like, dark chocolates, oysters, pear, all these things are good for improving mood and eventually improving heart health. So yeah, they will help improve your mood, which eventually improve heart health. So that's how I can think of it. And then hormonal balance as well. So it helps dilate blood vessels, yes. And also some of them are excellent sources of antioxidants. So yeah, thank you for that. For those who don't know what aphrodisiac foods are, chocolate is an example. Dark chocolates. Yeah.
Okay, so from Saya says follow up to the question she asked earlier. The proteins are meats, fish, and eggs, which is following up to the question where proteins aid in weight loss.
Ironically, these should rather make you gain weight and not lose them. Yes, so I mean, eggs, meats. But I mean, again, it depends on the kind of meat you are taking. Lean meat is good, but if you are taking a lot of fatty meats, of course, it's going to make you gain weight instead of losing it. Eggs, a lot of eggs in a day, obviously will make you bloated and then, I mean, make you gain weight. But everything in moderation. Yeah, everything has its good side and bad sides. So, yeah. So there's a question there from Albert. Sorry, I think they want me to follow up on the aphrodisiac drugs. So I was mainly focusing on the food. So aphrodisiac drugs are usually drugs that will make you high. The men know what aphrodisiac drugs are when you ask them. And sincerely speaking, it doesn't help. So as much as possible, if you can, please don't take these recreational aphrodisiac drugs. I mean, it will make the heart work over time. I've actually had a lot of cases of people coming who have OD'd on these aphrodisiac drugs, and then midway in the middle of whatever they were doing, their heart stops beating. So please don't take them. But aphrodisiac foods are good in moderation.
Okay, thank you very much, Doctor. We have a question from Alberta that says, please, as a known high blood pressure, okay, to take bottled energy drinks sometimes?
So already these energy drinks cause a lot of palpitations, which I spoke about earlier. They make the heart work over time. So as much as possible, if you can abstain from it. I mean, everything is in moderation. That's like how I started by saying, ideally, in an ideal world, if you know you can't take alcohol, stick to it. But if you know you are taking it, then you have to now have or take it in moderation. Yes. So if you're sometimes, because I know sometimes Ghanaians will say, oh, I take it occasionally, but this is someone who has an occasion every day. So your occasionally might not be someone's definition of occasionally. So I mean, once in a while, I mean, it's allowable, but if you can, please don't take it. Yeah. You already have hypertension too, so that puts you at an increased risk compared to the general population. So if you can, please don't take it.
Okay, so we also have a question from Christine that says, there's a notion that wine is good for the heart. Is this?
All right, thank you so much, Christine, for this brilliant question. I think I touched on it during the presentation, but I'll re-echo. So specifically, the wine that we talk about when we say, or what people say is good for the heart is red wine, not Chardonnay or white wine. So red wine is what is considered good for the heart. And the reason why people would even say that is that red wine has a certain antioxidant, which is called resveratrol. It's very big, I know, but it's called resveratrol. You can look it up and read about it. It's an antioxidant, and what it does is that it increases levels of high-density lipoprotein, and this is good cholesterol. So some people see it as, I mean, a good source of, it's good for the heart and all that, but they don't actually know the reasoning behind it. So the reasoning behind it is that it increases levels of good cholesterol. However, this antioxidant that I'm talking about, the resveratrol, it can be found in grapes, berries, and nuts. So if you can do without alcohol as much as possible, if you want to get what this red wine is giving you, then why don't you take the grapes and the berries and the nuts, which will give you the same thing that the red wine is giving you. So as much as possible, if you can, don't take alcohol. But if you have to, then take it in moderation. But yes, it's because of the antioxidants, which helps with good cholesterol. That's why people have the notion that red wine is good for the heart. Yeah.
Okay. So I also have a question here. Men lose their erection when they get hypertension. Can it be reversed?
That's a good one and a valid one. I get this question almost every day, especially with men when you put them on certain antihypertensives. So hypertension in itself, the closest thing to reversal that you can get is if you are taking medications that help control the hypertension. So if you take medications that antihypertensive that you are prescribed with, exercise a lot, eat healthy, cholesterol control, and all that, of course, it's going to improve your overall health as a man in general. Yes, so it will help improve your erection. However, some people also have this fear of taking certain antihypertensives. It is true that certain antihypertensives also cause some erectile dysfunction, but if you weigh the risk and benefits, it's better to have your hypertension treated for overall health than, not take it because you fear having an erection loss. So yeah, some people have, so it can be either ways or both ways. Hypertension causing erection problems in some people, and then some antihypertensives also causing it. Can it be reversed? If you obtain optimum blood pressure control, you exercise, you eat well, yeah, I think you would have a healthy sex life.
Okay, a question from Rita Ninsen that says, on the question of red wine being good for the heart, is sweet wine inclusive?
So red wine in itself, yes, is cardioprotective, or it has some heart protective effects, like I explained earlier. But this same thing that is found in red wine, like I was saying, can be found in grapes, berries, and nuts. So if you can take these ones instead of the alcohol, then please take them. Sweet red wine, people think it doesn't have alcohol, but it does. It actually has alcohol. So the dry wine and the sweet wine, they're all alcoholic. So.
Okay, I'm sure we are out of questions now. Please, if you have any last minute questions, kindly drop them or raise your hand. We'll answer them and then we can move on. Okay, I'm seeing there has not been any questions yet. Please ask your questions now for us to close the meeting. Okay, thank you very much for taking time out of your busy schedules today to join us. Your health is your greatest asset, and I'm sure you know that. The conversations that have been had in this webinar will help you improve your overall healthcare on your day-to-day runnings, your busy schedules, everything. So as you already know, Equity Health Insurance, we remain committed to not only providing coverage but also promoting preventive health and wellness education. If you have any further questions, please feel free to reach out to us after this session. And once again, thank you very much for joining us today. We wish you a healthy heart day ahead. Thank you very much and have a wonderful day.
Oh, sorry, I think there are some 2 questions here that just came in. I think we can just tackle those 2 and then take it out from there. Is that fine, Hafsa?
Yes, please, that's fine. Christine.
Okay, sure. So someone asked Ajaman, does someone who's not have a risk of heart-related complication? Yes. So usually people who snore tend to have, or not always, but in this instance, there's something we usually call obstructive sleep apnea, OSA, yes. And this usually has an increased risk of cardiovascular issues because you have a higher risk of high blood pressures, irregular heartbeats, and all that. So yes, if you know someone who is snoring abnormally or way too much, you can take them to the hospital. For you know, it's not just the regular snore, but it could be obstructive sleep apnea, which will put them at risk of hypertension and other cardiovascular conditions. So thank you for the question. There's also a question here about, is fat pork safe for health? So everything in itself can be safe or unsafe depending on how much you take in. But the fat pork generally contains a lot of bad cholesterol if it's eaten in excess. So that's what you call the low density lipoprotein. That was what tends to be a lot in pork. So too much of fat pork or pork throwing fat in pork, sorry, would lead to you getting a lot of the bad cholesterol filling up. So instead of taking fat pork, why don't you take lean cuts of the pork, or even just lean meat in general, instead of the fat parts of the pork. Yes, so you can try that instead of going for the fat itself. Yeah, try the lean meat itself in moderation. Fatty fish too is good. Cod liver oil, yeah, is good. So you can try that. But thank you so much for your questions. I really appreciate your time and your questions as well. And thank you for staying with us through the challenges with the internet. All right. Thank you. Thank you.